Here we go. Hello, Becca. My name is Kailyn. I'm your student nurse today. How are we feeling?
Your hand sanitizer over there.
Oh! Fine. I'm gonna go ahead and wash my hands. Do you feel like you have adequate privacy right now?
Yes, I do.
And you feel like you're safe? You look like you're not gonna fall over or anything. You feel dizzy at all?
No.
No? Okay, good. Alright, I'm just gonna ask you a couple of questions, okay? Not the picture. Okay.
A little bit more. Okay, there you go.
Okay.
Now you're fully in it.
Alright. So can you just tell me about your medical history, any medical diagnoses?
No.
No? Any medications you're currently on?
Just birth control.
Any side effects from that?
No.
Alright, any supplements or herbal supplements that you're on?
No.
Okay, good. Walk me through your day, like what do you eat in a day?
I have oatmeal for breakfast, then I have a salad for lunch, and then I have a sandwich for dinner, and then I have a banana for snack.
Okay, very healthy, good job. Okay. How often do you exercise?
3 times a week.
Okay. And what kind of exercise do you do when you're exercising?
I walk my dog.
Good. Alright, and how much do you smoke?
I don't smoke.
Alright, and how much do you drink?
I drink maybe once a week.
Okay, and how many beverages do you have when you are drinking?
Maybe 3 at most.
Okay. And what kind of, have you had any surgeries in the past?
No.
Alright, good. Any family history of any diseases?
No.
Good. Alright. So I'm going to go ahead and ask you just some other general questions. Can you just tell me your name and date of birth?
Yeah, Rebecca Ann Foster, March 14th, 2001.
Okay, good. And what city are we in?
Bay City.
Alright, good. And what year is it?
2022.
Alright, good deal. You are ANO times 3, that's good.
Yeah.
Alright, I'm just going to run and get the stuff for vitals really quickly, okay? So we're going to start with your blood pressure. Where do you normally run with your blood pressure?
About 110 to over 70.
Okay, 110 over 70. Alright, we're just going to find your brachial pulse. Alright, found it. Got a nice strong brachial pulse.
Oh, yes.
My bell is on. Just gonna make sure.
Here.
Okay. Alright. Just gonna get tight. Alright, you're at 112 over 72. And I was listening to my diaphragm. I'm not sure if I said bell before. It was my diaphragm.
Okay.
This off. So that's a good blood pressure. That's under 110 over 80. We're just like what we want to see. It's tight. Or not tight, it's sticky.
Yes.
Alright. So before I put this on, let me just see your hands and check for any clubbing. I'm not seeing any clubbing anywhere. And your cap refill is good. Less than 3 seconds. Perfect. Alright, just go ahead and put that there. I'm going to get that going while I check your pulse. Radial pulse for a minute. Good. So your pulse was 64 and your respirations were 14. And normal for respirations is 12 to 20 and pulse is 60 to 100. And this was good. This was 97%, so it's normal is 94 to 100. 98 degrees, that's perfect.
Woohoo.
Normal is 98 to 99. 97, 99. I'll put these back. Alright, and before we get started on your skin assessment, are you feeling any pain anywhere?
Nope.
No? Okay. Alright, let's go ahead and look at your hands. So I'm just going to start with your hands. The color is good, nice and pink. Temperature is good, they're warm. It's warm.
Just put those up for
Yeah.
easy.
Alright, warm all the way up and even. And then just looking at skin integrity, I'm seeing a mole here. Anything change with that mole? Been there for a long time? No changes? Okay. And then this tattoo, is there any issues with that when it
No.
happened? No infection or anything?
Mm-mm.
Alright, I'm gonna go ahead and muscle tone feels even all the way up. It's symmetrical. Now I'm just gonna test your pulses. So your radial pulse first. Alright, and that's good, equal bilaterally. Okay, brachial pulse is symmetrical, good. Alright, and, oh, sorry.
You're good, you're good.
Okay, so now we're just gonna go ahead and test your range of motion. So can you just do a swimmer's thing for me? Good, other way. Perfect, no carpitis. Alright, other side. Good. And good. Any pain doing that?
Nope.
Alright, good. Alright, can you just roll your your wrists around in circles for me? Perfect. Any difficulty or pain? No?
Nope.
Alright, other way too?
I don't know what way I did, but I'll do this way now.
Perfect. Alright, so now we are just going to we're going to test your spinal accessory nerve. So I'm just going to have you shrug your shoulders. Perfect, that is intact. Now will you squeeze my fingers for me? Good, equal bilaterally. You're symmetrical both sides, good. Alright, now we are going to move on to your head. Okay, so first, inspecting your face for symmetry. Looks good. Alright, any pain in your head at all, or your scalp? Any
Nope.
problems with your hair or anything like that? No? Alright, I'm just gonna look around, feel for lesions or anything. Do you feel any pain when I'm doing this? Just tell me, okay?
No, I'm good.
Okay. Alright, I'm not feeling anything, and then your hair does not seem to be falling out. That's good. I'm just gonna palpate your occipital lymph nodes. Any tenderness when I'm doing this?
No.
No? Good. Alright, now we're just gonna test some more cranial nerves. So we're gonna test your trigeminal cranial nerve right now. And let me just get my tool to do that. 1 second.
You can start.
Okay. Just tell me where you feel the sensation, okay?
My right cheek,
Okay, good.
my forehead,
Good.
my chin, and my left cheek.
Perfect. Alright, now we're just going to have you clench your jaw for me. Just 1 second. Alright, go ahead and clench. Perfect. Alright, so your trigeminal nerve is intact. Now we're going to test your facial nerve.
Okay.
So go ahead and look at me and smile, frown, angry face, puff your cheeks. Perfect. So your facial nerve is intact. Now we're going to move on to your eyes. When was your last eye examined?
About 4 months ago.
Okay. So when they do that, they check your optic nerve just to make sure it's functioning well. And do you have another one scheduled?
Yes.
Good. Alright, now I just need to look at your eyes. Your pupils look nice and round, and your sclera is white, and your conjunctiva is nice and pink. They look moist, and your eyelids appear to have no lesions or abscesses on them, so that looks good. Alright, now we're going to test your corneal light reflex. Alright, perfect. Your eyes are reactive consensually and direct, and they've dilated and did what they're supposed to do. Okay, now we're going to do accommodation. So go ahead and look at my nose and then look at the wall behind me. Perfect. So your pupils are equal, round, reactive to light, and they accommodate perfectly. So, very good. Alright, now we're going to test your 6 cardinal fields of gaze, and this is just going to be testing your oculomotor, your trochlear, and your abducens cranial nerves. So go ahead and look at my pen light and just follow with your eyes. Alright, perfect, those are intact. Now we're just going to check your cerebellar function, so make an okay sign at me. and tap all your fingers on your thumb. Do that as fast as you can. Perfect. All right, hands on your thighs, and then flip them over and do that as fast as you can. Perfect. All right, now we're gonna do, you're going to touch your nose and then my pen light. And again. One more time. Perfect. All right, now we're gonna move on to your nose. So I'm just gonna look up your nose here. I'm seeing some nice moist mucosal membranes. Your septum appears to be straight. And I am seeing those turbinates, which are normal ridges in your nose, so that's a good thing. I'm not seeing any polyps or lesions or anything, so very good. All right, and before I start this next test, do you have any food allergies?
No, I don't.
Okay, let me just go get my scent.
Okay.
Go ahead and close your eyes. And what do you smell?
Coffee.
Okay, good. Your olfactory nerve is intact and functioning. All right. Next, we're going to palpate your sinuses. So first, we're going to start with your frontal sinus. Any tenderness?
Nope.
No. Now your maxillary sinus, any tenderness?
Nope.
Noting any swelling in there, so that's good. Now we're going to go look at your mouth. When was your last dental exam?
About 4 months ago.
Okay, good. And you have another one scheduled?
Yes.
And how often do you brush your teeth?
Once a day.
Okay, good. All right, so your lips look nice and hydrated. Go to your mouth for me. Any pain in your mouth ever?
Uh-huh.
Well, your mucous membranes look very nice and moist. Your teeth look good. Your gums look good. You see your tongue and your throat. All right, those all look good and moist and pink. Perfect. All right. Now we are going to have you test a couple other facial or cranial nerves for me. We're going to test your glossopharyngeal, your vagus, and your hypoglossal cranial nerves. So I want you to swallow for me. Perfect. And do you have a gag reflex?
Yes.
Yes. All right, go ahead and stick your tongue out and say ah. Good. Now, can you stick your tongue out and move it left to right for me? Perfect. And can you say light, tight, dynamite?
Light, tight, dynamite.
Very good. All right, those are all intact and good. All right, now we're going to go ahead and look at your ears. Any pain in your ears?
No.
All right. Any trouble with these piercings?
No.
Okay. Just feel them. No pain when I'm touching them?
Nope.
Okay. I'm not seeing any lesions on them. All right, no pain with that ear either?
Nope.
Okay, perfect. All right, now we're going to go ahead and palpate some lymph nodes. I'm going to go ahead and palpate your post-auricular lymph nodes. Any tenderness?
Nope.
Your pre-auricular lymph nodes, any tenderness there?
Nope.
Good. All right, now we're going to go ahead and look at your neck. So first, I'm just going to check your tracheal alignment. All right, that's nice and straight. And I'm not noticing any difficulty breathing or not using any accessory muscles to breathe. That's good. All right, and then I'm going to look at the color and inspect your throat or your neck. All right, has this mole been here for a long time?
Yes.
No changes? Okay. Just going to feel the temperature all the way around. All right, that feels good. Not seeing any lesions or anything abnormal. Looks good. All right, next we're going to auscultate your carotid artery with my bell. So that's just checking for any bruits, which would indicate some kind of aneurysm. So
Oh, I hope I don't have any of those.
we're looking not to hear that. All right, and my bell is activated. Okay. Listening for bruits, which are swooshing, whooshing sounds. All right, not hearing any. That's good. All right, good. No bruits. Now we're going to palpate each carotid separately. So first, I'm just going to make sure I can feel a pulse in this one here. All right, good, strong pulse. And again, good, strong pulse. That's a good sign. All right, and next we are going to feel all of your lymph nodes. We're going to palpate your lymph nodes. So I already checked your occipital and your post and pre-auricular lymph nodes. I'm just going to check the rest of them. All right, I'm going to start with the posterior cervical lymph nodes. Any pain or tenderness?
No.
All right, I'm just going to go ahead and feel the superficial cervical lymph nodes. Anything there?
No.
All right, and then the jugular digastric. Anything there?
No.
All right. Submandibular, any pain?
No.
Submental, any pain?
No.
I'm going to go with deep cervical chain here. No pain?
No.
All right, now I'm going to have you scrunch your shoulders forward. I'm going to feel your supraclavicular lymph nodes. All right. Those are all good? No pain in any of those?
No.
All right, I'm just going to check your tissue turgor right now. I'm just going to pinch on your clavicle. All right, skin return just to where it should be. You're very well hydrated. That's good. All right, and next we're going to check out your skin on your back. So I'm gonna have you spin around for me. Alright. So I see this tattoo. Any problems with this tattoo or infections?
No.
No? Alright, I'm just gonna feel the temperature throughout. I don't see any lesions that are concerning to me. Alright, that all looks good. Any pain anywhere? No. Okay. I'm gonna go ahead and check your AP ratio. Just touch your breastbone and your spine here. Okay. Doing that. Okay, so you have a good 2-to-1 ratio, so no barrel chestedness. That's good. Alright, if you want to just sit right there, and then we will palpate your thyroid in a little bit here. Okay, so we're going to percuss your lungs in 12 different spots. So I'm going to start right up here, and it should sound like resonance, like a dull, empty space. Or a hollow, empty space. Not over any bones. Move your bra a little bit, I'm sorry. Hearing resonance in all these spots. Last spot. One more just to be safe. Okay. So we percussed all the spots of your lungs. Now we just need to auscultate your lungs. So I'm going to again listen in those 12 spots, but this time I'm listening for a wind-like sound, just indicating that there's no congestion, that your lungs are working as they should and moving that air around. Okay, I'm listening with my diaphragm. Not over any bones. Alright, deep breath for me. Good.
Just make sure they can see you. Or see where you're putting it.
Huh?
Just make sure they can see where you're putting it.
Oh, okay. Thank you.
Mm-hmm.
Alright, just make sure there's a good camera angle. So again, here. Good. Okay. Good. Again. Okay, again. Okay. Alright, again. One last time. One more just to be safe. Deep breath. Okay. And deep breath. Very good. Heard a wind-like sound in all those spots I just auscultated, so that was good. I'm just going to check your AP ratio now. So, your, not AP ratio, your lung expansion. Okay, so go ahead and take a deep breath. Good, very good. My hands separated just how they should. Alright, so I'm just going to have you spin around for me so I can palpate your thyroid. And just get kind of near the end of the bed for me. Okay. Good, can I carefully see? Alright, so I'm just finding the area where the thyroid would be. I'm pushing it to the side. Take a swallow for me. Good. Other side, I'm going to take a swallow. Okay, swallow. Perfect. Alright. Didn't feel anything, but if I did, I'd want it to be nice and squishy. Okay? You can go back and lay down for me. Okay, and first we are going to look at your jugular vein, just make sure there's no dissension, so go ahead and look that way
Hold up
for
one
me.
second.
Okay.
Hold on. I'll come back. I'll come back. Is that face on there? Is it working? Not working?
It is. It's just weird. Okay. Okay. Go ahead and turn your head that way for me. All right. I'm not seeing any jugular vein distension, so that's good. I'll give your pillow back to you.
Yes. Sorry.
You can lay back down. And then just for the camera's reference, this is the patient's right, and this is the patient's left. All right. Now we're going to inspect your chest. You can pull your, yeah, there you go. All right. So right now I'm just inspecting that the skin is dry and warm all around, and there's no lesions. Any pain in your skin and your chest ever?
No.
No? All right, there's no lesions. The temperature is good all around, and it's pink, it's dry, looks good to me. All right, now we're going to auscultate for your heart valves. So first we're gonna start with your aortic valve, which is going to be in the second intercostal space on the right. So there's one, there's two. All right. Listening for a lub-dub sound. All right, perfect. Heard lub-dub. Now we're going to listen with the bell for extra heart sounds. I'm hoping to hear nothing.
I hope you hear nothing too.
All right, perfect. Now we're going to go to the left side and find the pulmonic valve underneath the second intercostal space. All right, so there's a second intercostal space, and we're going to listen to the pulmonic valve, hoping for a lub-dub sound. Very nice. All right, and then again with the bell for any extra heart sounds. All right, good. Now we're going to go to the third intercostal space to listen to Herb's point. Move your bra, okay?
Need it moved. Okay.
Okay. All right.
Okay.
All right, good. There we go. All right, good lub-dub at Herb's point. Now we're going to go to the bell. All right, not hearing any extra heart sounds. So now we're going to go to the fourth intercostal space and listen to the tricuspid valve. Hoping for lub-dub again. Very nice. All right, now with the bell, in the same spot for the tricuspid valve. All right, no extra heart sounds. Now we're going to the fifth intercostal space to listen to the mitral valve, which will be over here a little bit more. And I have my diaphragm activated, listening for lub-dub once again. Very good. Now we're going to listen with the bell for any extra heart sounds. All right, nothing extra. Now we're going to take your apical pulse for a full minute in that same mitral valve spot. All right. Here we go. All right, 78 beats per minute. Okay. And now we're going to move to your abdomen. Yeah, so go ahead and get that covered up again. Make sure you have privacy, and then, yep, go ahead and pull your gown up for me.
Okay, good.
Alright, good. So while I'm inspecting it, do you ever experience any pain in your stomach?
No.
Alright. And I am noticing the aortic heartbeat, aortic pulse in the epigastric region. I'm not seeing anything I'm concerned about, no lumps or bumps or anything. Looks equal. Okay, and I'm seeing you have a piercing. Any problems with that piercing?
Nope.
Nope. Alright, so again, I'm just looking and then I'm going to listen to your abdomen. And I'm going to start in the right lower quadrant, just hearing for any gurgles, which are bowel sounds. Hearing for 5, okay? Alright, here we go. Got an active bowel today.
Mm-hmm.
Alright, good. I'm hearing 5 of those gurgles every time.
That's good. That's what I want to hear.
Can't hear you. Alright, there was 5. And then we're looking for 5 more here in the lower left quadrant. Alright, very good. And what was your last bowel movement?
Today. Earlier today.
Okay. Alright, and now I'm going to listen to the arteries in your stomach just to make sure there's no aneurysms. So I'm listening for bruits again with my bell. Okay. Aortic first. Alright, no bruits there. Your left renal artery. And your right renal artery. Good. Your left iliac artery. Good. Now your right iliac artery. All right. Now we're going to palpate to find your femoral artery so we can listen to that as well. All right. All right, again with the bell, we're going to listen for any bruits. All right, no bruits there. All right, and no bruits there. We are going to move on to percussing your abdomen now. And again, just so everybody knows, this is the patient's right, this is the patient's left. They're gonna get kind of covered up. Okay, so I'm just gonna start in your right lower quadrant, and I'm just going to try and listen to a tympanic noise when I percuss. Okay, here we go. Good, all tympanic. Good there too. Those are all tympanic. Now the left lower quadrant. Good. Alright, so I heard tympanial spots. Now I'm just going to percuss for your liver border. So I'm going to start at the right lower quadrant. It'll switch from tympanic to dull. There we go. So that's where your liver border is because it turned from tympanic to dull. And now we are going to go to palpating your abdomen. We're going to start with light palpation. So here we go in the right lower quadrant first. All right, not feeling any lumps or anything. All right, I'm moving up a little bit. Good. No masses or anything? Any pain at all?
No.
Okay. Okay. Now we're gonna move to deep palpation. So if this hurts at all, just let me know, okay? This is about 5 centimeters beneath the abdominal wall. Okay, not feeling any masses. All right, that feels good. All right, now we are going to go ahead and get you sitting up. All right, we're gonna go ahead and look at your legs.
So I'm not sitting up.
You're not sitting up. I misspoke. Trying to skip steps. All right.
Thanks for giving me my little
Yeah. You feel like you have privacy right now?
I do.
Okay. All right. So we are going to start just by inspecting your legs, see if there's any lesions or anything that I'm worried about. Do you ever have any pain in your legs? No. You have. I'm gonna go ahead and check your cap refill. Those look good. Less than 3 seconds. What we want to see. All right, and I'm just checking temperature, and it all seems equal and good all throughout. I'm just gonna check for edema. All right, I'm not seeing any edema. Now I'm just gonna check the muscle tone. All right, and muscle tone feels good all throughout. All right, and we're just gonna check your pulses now. So you can just lay just like that, right there. All right, I'm checking your popliteal pulse. All right, good. Now I'm gonna check your posterior tibial pulse. So those were equal, and these appear to be equal as well, just make sure. Yeah. Now we're gonna check your dorsalis pedis pulse. All right, that feels good too. So your pulses are equal symmetrically on both sides. All right, now we're just going to do a sensation test. So you're just gonna tell me if you feel the sharp or light or dull sensation. I'm just gonna give you an example of both. This is sharp, and then this is dull. Is that okay for you? Can you tell the difference?
I can't.
Okay, all right, one more time. So sharp, dull. Can you tell the difference?
Push harder for sure. No, I can tell the difference.
All right, here we go. We're going to start. So go ahead and just close your eyes. And I'm just going to touch different parts and just tell me what you feel and where.
Sharp right calf.
All right.
Dull bottom left foot.
Okay.
Sharp right. I don't know if you want that as thigh or knee, but whatever you want to call that.
Good. All right.
Sharp right top of foot.
Mm-hmm.
Dull left calf.
Okay, and last one.
Dull bottom of the right.
Okay, good. All right. So,
Did I get them all right?
you did. Yep. Looks like your sensory perception is all set. All right, now you can go ahead and sit up.
Oh, I was falling asleep down there.
Can't have that.
No.
Okay, so first we're just going to test some range of motion.
Okay.
So I'm going to go ahead and lift the blanket up if that's okay.
That's okay.
And can you just twist your ankles around in circles for me?
I'm about to do my hands.
I did that one.
Oh,
All right.
they can't see it.
Oh,
Yes, they can.
do it there.
Did you saw my ankles?
Oh. Well, you can see your legs moving.
Yeah.
Oh, okay.
Her ankles are moving in circles. Good. Okay, so go ahead and, oh, hold on. Bring your feet up to my hand. Perfect. All right, now I'm going to have you push against me. So push against me. Good. Push against me. Good. All right. And now we're going to check your patellar reflex. Okay. Where's the hammer?
Oh, it's over here.
All right. Do you have a strong patellar pulse normally?
Oh, yeah, I do. Not today.
All right. All right, good.
A little bit better.
Okay, so it looks like all your Range of motion and reflex things are good? Alright, now we're gonna go ahead and get you standing up, okay? Let's get your shoes on.
Oh, they're somewhere. I thought I'd
They're right here.
Okay.
Alright, before we even start, are you feeling dizzy at all right now? No? I'm gonna have you stand up for a minute just with me right here, just in case, okay?
Sorry, it takes me a minute.
You're okay. Alright.
Well, I want to see
Okay. Are you feeling dizzy at all?
my No.
Alright.
Tiny.
Yes. Okay. Alright, so we're going to go ahead and start the Romberg test. So you just close your eyes and stand there. We're just looking for any swaying or any just excessive movement. This is just testing your acoustic nerve. Just for 20 seconds, almost done.
20 seconds seems like a long time with my eyes closed.
It does, doesn't it? Alright, so your balance is good. That was a negative Romberg test, which is what we want to see. Alright, so we're going to go ahead and do some walking just to make sure your gait is normal. So we're going to go ahead and move this. Thank you. Alright, so just start from over here with me. We're just going to walk normally to this wall. Good. And let's turn around and walk heel to toe back over there. You alright? I'm right here with you. Okay, that was good. You can go ahead and sit back down. So I'm going to give you a 23 out of 23 braid and wrist sore because you have very good sensory perception, good nutrition, good mobility. You're not incontinent at all, so there's no real risk for any moisture. So very good job, 23 out of 23.
Woohoo! Yay.